So let's talk about this gut involvement that you mentioned. So I don't want to forget that. Tell me a little bit about. It seems like the gut always gets involved, no matter what we're talking about. Whether we're talking about psoriasis, the gut seems to always somehow be involved. So talk to me about gut involvement when it comes to encephalitis and just neurology in general. What does that look like? What's it usually paired with?
Yeah, I don't know if it's as much in encephalitis. It may well be, but encephalitis is presenting so dramatically with the mental status changes that we usually can't even get at asking questions about gut. These patients are in the ICU and we're just really trying to stabilize them. But in autoimmune neurology as a field, when we're talking about all of the other conditions that we treat, um, and this probably involves me kind of defining the true scope of what we treat. It sounds like alphabet soup sometimes, but a lot of big terms for conditions like neuromyelitis optica, myelin oligodendrocyte glycoprotein-associated disease. Um, a lot of neurorheumatologic conditions end up in our clinics where it may be that a neurologic symptom is taking the front seat, but when we ask, we end up figuring out that a neurologic symptom may be the first manifestation of something like lupus or Sjogren's syndrome. You were getting at psoriasis. Increasingly in my clinic, I have referrals where, again, people have a prominent neurologic symptom or sign that's really interfering with their life, the reason that they're coming to seek medical care. And you just ask a few questions and you figure out very quickly that it's part of an entire systemic autoinflammatory syndrome. But they were able to ignore the rashes, ignore the arthritis, right? They were just going about their life. They were powering through until the neuro symptom came. But then 10 minutes into the interview, it just all comes tumbling out when you ask a few questions. And yes, the gut is almost always involved. From my bias as a neurologist, I think it's because the entire gut is innervated. There's something called the myenteric plexus. So the entire way that we move food through our gut is all run by a nervous system,
Mhm.
right? We tend to lump it more generally under the category of the autonomic nervous system, things that should happen automatically that don't. And so if the nerves are involved somewhere else, you you can bet good money that a lot of the times the nerves are going to be involved in the gut. It doesn't get the press that it deserves,
Mhm.
and because maybe there's a more dramatic neurosymptom or something else going on. But absolutely, when you ask, um, it's very rarely that I have a patient in my clinic who says, "Oh no, I've never had any problems." Yes, when you ask patients in the outpatient setting, especially if they're having neurologic symptoms related to their immune system, I ask all the time, "Hey, how are your bowel movements? Hey, any constipation, any diarrhea, any bloating?" The answer more often than not is yes, but again, this gets back to our silos. As autoimmune neurologists, we're trained to focus in
Mhm.
on the neuro and then step back very quickly because
Mhm.
very rarely, if it's immune system mediated, is it exclusive to the neurologic excuse me. So very often, if it's immune mediated, it's not just going to be in the nervous system. So we're trained to step back quickly. But otherwise in neurology, outside of autoimmune neurology, we don't get a ton of bowel in our training. We don't get we're not gastroenterologists. And so maybe we don't have time in a lot of clinics to bring this up. Or maybe we're just not comfortable with it, right? Because we are neurologic doctors. And yes, that gut is innervated, but it's not a prominent part of neurology training. It really is not. And so asking about it and getting comfortable as a neurologist with asking the right questions to begin to sort out, is this the nervous system and the immune system in the GI tract, and then referring to the appropriate person for that, even within the GI specialty, because only some GI docs really like to focus on the immune system part of the bowel. It takes time, and it's something I'm still working on all the time. I tend to be informed by the patients on this. They tell me what worked, what questions the GI asked that helped get to the bottom of it. But yes, it's all interconnected. And if you think about it, the entry to your immune system starts in your mouth, right? So it's very easy to get that immune system exposure every time we eat. right? And it can just open up the immune system to a whole bunch of other targets from there.